Welcome to today's Chat About Children. My name is Linda Southward, and I serve as director of the Children's Foundation of Mississippi. The Children's Foundation believes that for Mississippi to reach its potential, we must help children reach their potential. And the Children's Foundation, among our many projects, also produces periodic Chats About Children, a video series on different topics relating to children across Mississippi. Today, we are delighted to welcome Dr. Angela Bass. Angela is the Executive Director of the Mississippi Early Learning Alliance, MELA. MELA drives collective impact with diverse stakeholders to achieve systemic change, leading to the holistic development of Mississippi's children, focusing upon their first 8 years of life. She earned her PhD in educational leadership from the University of Mississippi. She earned her master's in education policy and management from the Harvard Graduate School of Education. And she earned her bachelor's degree in comparative women's studies from Spelman College in Atlanta, Georgia. She is also currently a member of the Mississippi State Board of Education. Prior to her work at MELA, she was Deputy Director of Policy at Mississippi First and was previously a school administrator in Memphis, Tennessee. She's also had classroom experience in teaching math to middle and high school students in Tunica, Mississippi, Horn Lake, Mississippi, and Forest City, Arkansas. Dr. Bass is originally from Tunica, Mississippi, by the way of Horn Lake, Mississippi. Currently, she resides in Jackson, Mississippi, with her husband and 2 children. Angela, welcome.
Thank you so much. That was a very generous bio that you gave of me. So
thank you, Angela, for making time out of your busy schedule to come and have a chat about children. And even though, as I've just mentioned, and I didn't mention all of Angela's many professional accomplishment accolades, the topic for today's chat will be much more personal. Angela, thank you again for graciously agreeing to share from a parent's perspective your family story from having a young child who survived multi-symptom inflammatory syndrome in children, MIS-C, after exposure to COVID-19 at the end of 2020, and I believe an early diagnosis earlier this year. And we'll make a special note, this was before the Delta variant strain that is out there now, which is obviously even more contagious. So let's just go ahead and say, first, we're extremely pleased, along with you, elated that your son is doing well and is past MIS-C, and that he had following his exposure. So we want you to tell the story in your own way and what you feel comfortable telling, things about his symptoms, what really got you concerned that he needed to go to the hospital, those sort of things. I've also recently learned that you have I knew that you had quite a following and had a lot of information on social media, but a national news story also came and spotlighted what happened and the process and journey that you went through. So maybe we just start at the beginning on what were some of the symptoms that you were seeing and any other background information you'd like to share.
Yeah, thanks for that. So I guess I'll start with just talking about, and this isn't directly related to what you asked me, but we had to make a choice, like so many parents do of young children, whether to risk exposure to COVID by sending Kevin into a learning environment in 2020. And, he was a rambunctious 5-year-old. And initially we, kept him at home for as long as possible. But, we wait, he was otherwise very healthy. And we weighed our options and said, we're going to send him to a child care facility that had been following all of the CDC recommendations and that we felt was really safe for him, just because we felt like that really was what he needed to prepare him for school. So in the midst of all of this, parents are still thinking about school readiness. And so I think the beginning of my story starts there. And every day I would, feel his head, make sure he has no fever. And he was getting regular checks for fever, like on a daily basis, as they enter the building every day, they were making sure that there was no fever, and he was fine. So he started at the child care facility right around time when school started. I opted not to send him to the virtual school that public schools had provided here in Jackson. Just because I just didn't think that was a good option for him. He needed to be in person learning. And so
this was all fall of 2020.
Correct.
Yeah. Okay.
So he went to a child care facility. They had done an awesome job with making sure that children and staff members were safe. We did have a couple outbreaks, but we were communicated with very appropriately, and quarantines were taken and those sorts of things. So we knew that there was a possibility that he may be exposed to COVID, but we were doing everything in our power to make sure that, we were not spreading it and we were being really safe.
Sure.
So right around at the end of December, after Christmas time, I took him to daycare, and they just told me they called me from school and said he wasn't feeling like himself, but he didn't, have any fever or anything. And so what I did was take him to the pediatrician. I was like, well, maybe it's COVID, and I want to make sure that he's negative. So he had a COVID test. It was negative. He had a strep test. It was negative. He had a flu test. It was negative. But he did have some vomiting. And he said his belly hurt. And so, my pediatrician was like, he probably, ate something or some kind of like stomach virus. And so, just continue to monitor it. And if it gets worse, bring him back. And so that's what we did. And in the meantime, his fever shot up to 104 in the middle of the night. And so at that point in time, I went to the emergency room because that was just really frightening for me.
Yes.
And this part of the story is very common for MISC parents. So there's, they go to their pediatrician, and the symptoms at that point are very similar to symptoms for lots of things. And so, doctors are, they give their very, professional opinions. So like, it could be anything, just go and wait it out. Right. For MISC kids, then it often gets worse. And so that's what happened. And for us, we, went to the ER, we got the same diagnosis. This is something that's, related to his gastro system, probably a virus, and, you should go home, because at that point, we didn't have a positive COVID test, a positive strep test, or flu. And so, they were not really concerned. They were like, keep him hydrated. And so that process of going back and forth to the doctor happened for 4 days. And this is the part of the story where I like to insert some of my advocacy for children into the story. And so, I recognize the privilege that I had to be able to go back and forth to the doctor. I live about 10 minutes from UMMC, which is the state's best place for children. They had a team of pediatric specialists like none other. And so I feel extremely privileged to be able to have, had that type of health care. But I know that that's not the case for a lot of Mississippians. And so, that's something that I just want to call out, that, our success or the in beating MISC was primarily based on our access to quick and fast healthcare, and getting that diagnosis quick. And that is one barrier to getting that is, being far away from a hospital or from a team that really specializes in kids.
Because we know Mississippi is such a rural state, and there are many children who live in areas without the specialist hospitals.
Right.
Or some counties where there's not even a pediatrician.
Right.
Entire county.
Yes. Yeah. I mean, like, I met people in the hospital that had driven in from counties, 2-3 counties away. That this hospital was the closest to them, and they had to drive upwards of 2 hours to get there. And I know that, I was thinking about, like, what if I had to drive 2 hours to the hospital? Like, how would I have done it so often, like come back and forth to the hospital every day? And could I have afforded to? I've talked to some parents on social media who talked about, well, like the price of gas to get there, or having to take off work in order to go and into the hospital. And so I just wanted to call out that, because it's something that I, developed an awareness of going through this, and will continue to take that experience with me in my advocacy work.
Oh, and thank you so much. Thank you so much. So we talked about some of the symptoms and how this really got started. So take us then a little further then. Yep. After the diagnosis was made, and what that part of the journey looked like.
So my last trip to the ER was when, by this time as a parent, I'm Googling, I'm calling people, sure. I'm trying to figure out what is this that's happening, because his fevers were shooting up really high. And I just followed my gut and said, like, this isn't a stomach bug. This is something deeper. And I got to the point to where he could not swallow the medications that kept his fever down. So
how frightening that had to have been.
Yeah, and he wasn't eating, he wasn't drinking, and I was like, it's time to go back to the hospital. And at that point, he had started to develop a rash, and everything that I read on the internet, which I don't recommend a lot of, because the internet is a scary place. But in this case, it really informed me as a parent, and I saw the rash. Now, this is one thing that I also want to call out. His skin is darker, and I could notice the difference between like his skin before and after that a doctor may not have picked up on, because they don't see him every day. So I really advocated, for him, and saying that no, like his skin is presenting different. And I know that this, with this, like, this is like classic MISC. Like, could it be MISC? And at that point, the doctor had made me aware that, like, yes, we're checking for that, actually. And so it was already on their radar by this time, because he had fever for 4 days, which is an important component. He had this rash, and then one of the things that they had to check to see if his inflammatory markers were high, and so they tested his blood and found out that his inflammatory markers were like had skyrocketed. And so then at that point, they admitted him to the hospital to treat him for something. But at this point, they still could not diagnose it as MISC because we had never had a positive COVID test. And so what happened was, like, a day into the hospital, his antibody test came back, and then it showed that he had COVID, the antibodies to fight COVID. And so that let us know that he had had COVID in the past. We never suspected it, and that his body was reacting to that, the COVID antibodies that were in his system. And so that's precisely what MISC is. It's not necessarily a reaction to COVID. His body had COVID. It fought off COVID very effectively. And then his immune system just kept going. It just keeps going, and it attacks every system in your body. And so it attacked his gastro system first, which was why we had the vomiting, and in his skin and his lungs and his heart, and everything became an emergency all at once.
So being admitted to the hospital, you were there several weeks, if I recall.
Yep. So we spent a total of 14 days there. And then 4 of those days we were in the pediatric ICU unit at the Batson Hospital.
My goodness. And so what were some of the most sort of amazing things you saw during that time period that are just seared on your mind and in your heart, that you would like to that you would feel comfortable sharing with a larger audience of parents and grandparents out here who may be listening in, and teachers and anyone who comes in contact with children?
Yeah, so I think one of the most amazing things, was obviously the quality of services that I got from the doctors, but not only just, having good doctors, but doctors that were really partners with me. So, they came to make the rounds in the morning, and they would come outside and, like, talk about his numbers. And I was a part of those conversations as a parent. And, the education that they gave me on, like, what was happening, what his treatment was going to look like that day, what they're looking for, how it could help. Those were very important things, not only for my sanity, but also, for Kevin, he had, they ensured that I could be the type of advocate that he needed in the hospital. And they listened to me. I would say, like, well, I don't think that. And they would consider what I said. And I was just really pleased with the partnership that I had with his team of doctors. I also say that, we had a team. We had a pediatric rheumatologist, a pediatric cardiologist, a pediatric infectious disease people, like all these different specialists that I wasn't even aware of before. And they broke down their roles, and all of these people had to come together and collaborate, like, across different departments and offices, to ensure that Kevin's treatment plan, made sense. And, different people were concerned about different parts of it, but I saw kind of how it all came together. And I was just really, really grateful for that. I'll also say just the support from outside of the hospital. So his school sending work, sending videos from his friends, that they were thinking about him, really kept him grounded, because I've been in the hospital with, like, an older person before, and I know kind of sort of how that is. But for a kid, everything is very traumatic. Getting an IV is very traumatic. And the other thing I'll mention is just, like, the types of support from hospital staff. Like there, I forgot the exact role. But there was a person there that, their job was to come and like play with him and make sure he knew about, things that were happening to him. So, he had to get a PIC line, which is like a longer IV that goes up here,
Yes.
close to his heart. And, they came in and acted it out with him. Like, okay, this is what's going to happen to you. And, you see how it happened on the doll. That's what's going to happen to you. And help him to sort of make sense of what was going on with his body. I think it was very important for his development.
Right. And how frightening that is, even as an adult who, as a parent, you wish you could take it for them, but obviously you can't, but to allay as many fears as possible. And I think what you said too is this whole team. I mean, the specialists and the pediatricians, then it's a whole team of healthcare support, nurses and physical therapists and especially during COVID, respiratory therapists and others who are the support staff, the folks who are keeping the hospital clean. I mean, it's a whole team of people that have really done a tremendous amount, whether it's pediatric or youth or adults in this whole system, and the sacrifices they are making for sure. But so then 14 days, 4 of which you said were in the pediatric ICU, all during this time as a parent, there must have been very little, if any, sleep. And so the impact not only of your child, but how this impacts the children, I mean, your family, and then also classmates who were concerned about his condition, no doubt as well.
Right. And I'll emphasize the impact, to the family. I also have another child, a daughter, who could not be there, even, during this time of COVID, that just was not allowed in the hospital at all. And then I had, Kevin, who was in the hospital, who, wanted to see his sister,
Sure.
so there was that dynamic that was happening. And I was grateful to have my mom, who was retired, that could be a full-time caretaker for her while my husband and I were sort of taking care of each other in the hospital, because as you mentioned, it was around the clock, care, even in the middle of the night, they're coming in, they're like taking the labs, and there are things to manage at all times. And so we really had to support each other. And it takes a village just to, I just cannot, I feel extremely privileged to have had a spouse and a mom who could come and support my house and my kids and me, and a job, where I would take paid time off to deal with these issues.
Yes, and so grateful and thankful for the outcome that has happened with your child, Kevin, and your family. But also, Angela, how you have been able, and you said this earlier in the chat about how having this experience that you've gone through in your family, how that has elevated an awareness of this specific syndrome, but also the larger healthcare system, and how we, just as the healthcare system collaborated, how important it is to collaborate across entities for children in this state, which of course that is your day job, and much more than that. And the Children's Foundation has been privileged to be able to work with Mela and other groups that have come together to look at the North Star, if you will, for positive outcomes for children. it sounds like it's a lot of lessons learned, and maybe even some metaphors for what you've gone through on how we can also elevate that for positive outcomes for children beyond the healthcare pandemic that we're in.
Yeah, yeah, I definitely think so. And for, I point to the work of the Children's Foundation and the work that you've done with the blueprint, which talks a lot, which sort of brings our mind to all these different systems that families interact with. And they need to work together for kids. And my example is a microcosm of what needs to happen for kids all across Mississippi, because when it can work well, we can have really great results.
Yes, absolutely. And when we think about the timeliness of this topic, just yesterday, the the American Academy of Pediatrics are reporting that of new COVID cases, 27% are now in children. And while the number of children who tested positive for COVID declined slightly within the last week, children are now making up a greater percentage of the total COVID cases in the most recent week across the country. Um, so this is such a timely topic. Thank you for sharing so much of your personal story of this. And we celebrate with you for what a positive outcome it was. I did watch the parade in your neighborhood, and the just cheers and posters and balloons welcoming him home after that just stay that was there. So if you could give a message or messages to parents or grandparents or teachers, whoever listening today, what would you want to say as sort of a takeaway?
Yeah, and before I hit on that, like, I would be remiss if I did not mention just um the people who I was in touch with at that time. So right around the time when he got sick, you saw my social media post. I
Yeah.
wanted to know everything and who knew somebody, and people really got back to me and said, like, hey, this sounds exactly like what my neighbor's kid just went through.
Mhm.
And I was able to actually connect with someone who had just left UMMC for MISC, like weeks before. And I think that type of connecting and relationship building and support really, really got me through, when there were times where his numbers just look so bad. And, I am able to smile and talk about it now, but it presented really badly. He was swollen all over, he couldn't breathe, and his vitals were just going all over the place. Like blood pressure was low. We didn't really know how bad it would get, but listening to, like, having the example of somebody who was actually in my shoes before this, and could say, like, yep, that happened to me too, and this is what happened next, just meant the world to me. And I was able to play that role for somebody else, and that person was able to play that role for somebody else. And
Oh,
just
yeah.
the supportive community that we've been able to establish, just in the little Jackson community, but also, there are Facebook support groups where people come on just looking for the same things, and they're all over the world. My kid is in Australia, and, he has MISC. What can you tell me? And we're able to say, yep, we had that treatment, and, ask them to try this. And if have they tried that, just that level of support has meant everything. But I will say, as a takeaway, to parents, the kid, if you can do your part in helping to protect kids, from being exposed to COVID so that they won't have to go through MISC. That, that would be extremely valuable to the whole healthcare community and to kids. I talked about the expansive team that had to treat Kevin. And, when I was there, we were the only case of MISC. And then I heard not too long ago that they had like multiple cases of MISC at the same time. And that can really wear on the hospital system and their ability to provide, high quality care across all the patients, and then other patients who come in for different things. Like, it takes a ton of resources to treat MISC. And so I think, one of the things that I've also become an advocate for is like, let's figure out how we can prevent this in the first place, and make sure that we're taking the necessary precautions. I know that, vaccinations is, something that has become very controversial. But, I was one of the first people to sign up to get the vaccine when it came out. So my family, everybody got vaccinated. And, we continue to wear masks and send Kevin to school. He's been able to go to school with masks on, and, just really being careful and taking all the precautions, because this was a nightmare. And, I wouldn't wish this on anybody, but I hope that, we can keep our kids safe, because that's the number one thing.
Oh, thank you, Angela. I think that's a good spot to end this on, but we encourage people to reach out to one another, to certainly read the research and look at the numbers. The numbers tell the story. If you've been vaccinated and you can do everything you can to prevent it, then if there is entrance into the hospital or a breakthrough, the outcomes are going to be much better than if one has not been vaccinated. We certainly know that. But thank you so much. You're such a gift to this state, obviously to your family, and now families across the world who have gone through some similar MISC situation. So we thank you. We are so thrilled to know about the Kev, who is doing well. And earlier in the discussion, you described him as rambunctious, and I hope he's more rambunctious than ever. And in a very positive way, and as we want the best for all children in this state, so and everywhere. So thanks again for the work that you do with Mela, with the State Board of Education, and all the many roles that you have. But thank you for sharing from your heart today as a parent, as a mom who trusted her intuitions and was able to get care to to your child that was needed. So thank you very much.
Thank you, Linda.